So we've highlighted some of the use of NMES devices, neuromuscular electric stim devices, but I want to just give you a primer on pad placement and some things that are sort of less obvious, more subtle around the usage of any NMES device. So the neuromuscular e-stim device that you have or that you use or can choose all has some general parameters. The first one is that if you're using this, keep in mind that it should always feel comfortable. And not all of them sort of work the same way. They use different waveforms, different ways to generate the waveforms. Some of them are only gonna be appropriate for use for 30 or 45 minutes. That's incredible. So if you can get 30 or 45 minutes of use out of it, great. If it starts to feel uncomfortable under the pads, if you've got red marks, those kinds of things, move the pads, give yourself a break, trust your feelings around this. Sometimes we see a lot of pad sort of placement issues, and I want to talk about that. Oftentimes what ends up happening is that we feel like we're really stuck on following a specific recipe around getting some kind of muscle contraction. So here I am, I'm gonna actually put it on the extensors of my forearm here, and I've just got a couple, and I've realizing that this is a group I want to work on. In this situation with the H-wave, and I love the H-wave because I can use it comfortably for indefinitely. But what I'm gonna do is just turn it up until I get a comfortable muscle contraction. Now, there's not necessarily benefit to jacking it to 10 and getting a crazy reaction. What we're trying to do is just get a muscle contraction that's comfortable. So if you're not getting the kind of contraction you want, move the pads around until you start to get the kind of result that you're after. And sometimes people think they have to turn the machine off, they have to sort of reset. You can't. You can just move this around until you feel like you're getting the kind of pumping that you're after. So feel free to explore, feel free to play with different pad placement until you get the sort of desired effect, what you want. And this is actually how all the pros would do it. If you came in and were working with us, we would help you move and find pad placement until you had good contraction. Now, a couple things about pad life. One of the things that's nice, I think, is that we all would like to take the pads and stick them to each other. And that's the fastest way to kill the life of your pads. If you can put it on something plasticky, that's great. Even like a soda can or La Croix can, even on the actual machine itself is a decent place to put this. Couple basic rules. Shouldn't feel noxious. Doesn't have to be maxed out at 10. Any contraction is positive. It should never hurt your incision. If it feels like it's tugging on repaired material, that's okay as long as it doesn't hurt. So keep in mind that we need to load these tissues, and you're doing that every time you move and do passive range or just create a contraction. So sometimes when people start to feel like they don't have conscious control over their muscles, they get a little bit twitchy. But in this situation, if I had an incision on my arm, there's plenty of other things I can pump. Remember that, let's say that I had a knee surgery, I could pump my quads, I could pump my adductors, I could go after the calves, and none of those things directly has to yank on the new incisions. Gentle motion that feels comfortable is the same thing as you flexing your muscle. So if you're having a hard time or you're afraid that flexing your muscle is gonna rip out something, then you are in a really hyperacute stage and your tissues are made out of, well, frankly, tissue paper. So if you can create a muscle here, then you can create a contraction there. That's a good sort of rule of thumb about, is it okay to move these things? Again, all the muscle contraction that you're generating should be comfortable, making sure that you're not creating irritation under the pads. So every 45 minutes to an hour, probably, you take a peek, and if it's looking bright red and irritated, move the pad somewhere else. If it looks fine and your skin is exactly the same, keep on pumping. The idea here is it's probably impossible to do too much muscle contraction. So what you're thinking is this comfortable? If I'm feeling super irritable and it feels gross, take it off, give yourself a break. The general NMES device use is anywhere in the system, anywhere in the limb chain where you're getting muscle contraction and dumping lymphatics are going to improve this system as a whole. So even if you repaired your quadricep ligament and you didn't want to pull on the quad ligament, there's plenty of real estate in the neighborhood to help decongest the big system. Last thing I'll say is, and this is, I'm just gonna get these a little wet. I want to show you something, and hopefully we can get this to pull off. is that you can actually cross the body. So if you are interested in, I'm getting contraction now on both sides. So oftentimes when we have a lot of effusion, a lot of swelling, and we can't get a muscle contraction because the tissue is so swollen, if you just put one pad on one side and one pad on the other side, you're gonna cross the spine and close that circuit. And you can see now that I'm getting a great contraction on both sides. So it's a kind of pro-level move. Obviously, you should use the directions and follow the directions. You can call the company, get some help, talk to your physical therapist. But ultimately, we're talking about a muscle contraction here. The only caveats are you pregnant? Do you have changes in your sensation? Are we concerned about creating muscle contractions in this way or not? But typically, these things are very, very safe for healthy people who are having just what we'd call orthopedic surgery. So again, notice that I've crossed here and I'm getting radical contractions in my forearms. So feel free to move around, play with the pad placement, and I think you'll have excellent results.